Now, the microscopic appearance would be large, round, polyhedral cells. The cells would be large, round or polyhedral in shape. They would have clear cytoplasm with abundant glycogen, and they would have a central nucleus and 2 to 3 prominent nucleoli within that nucleus. And these cells would be arranged in sheets, and these sheets would be arranged in poorly demarcated lobules that would be separated by a very fine or very thin fibrous septum. As you can see here, you can see very large round to polyhedral cells. You can see that have a very large central nucleus, and you can see very prominent nucleoli where the mouse pointer is. In this area as well, here as well, this as well, you can see within the nucleus very dark purple spots. These are the prominent nucleoli. Now, as you can see that this is a lobule, and this is a lobule, this is a lobule, this is a lobule, this is another lobule, this is another lobule. So these cells are, first of all, individual cells are arranged in sheets, and these sheets are arranged in lobules, and these lobules are very poorly demarcated. These are very poorly circumscribed histopathologically. On cross, the entire tumor will be very well circumscribed, but individual cells or the lobules, they are very poorly demarcated. And these are, as you can see here, the very fine. You cannot even see in the microscope that these lobules are separated by very fine fibrovascular structures or the stroma. Occasionally, sometimes you can see lymphocytic infiltrates, which are not very prominent in this case. Now, clinical presentation. It would typically present as a painless mass in the testes. If you see a patient, he complains that I feel a mass and it is painless, and you can actually rule out, or you can actually make a differential diagnosis of a seminoma or other germ cell tumors. And surprisingly, this tumor has minimal systemic signs. You won't see fever, you won't see inflammation, you won't see weight loss. The minimal systematic signs will be present there. And it is very important that biopsy is not to be performed, because when you put a needle in the testes and when you pull it out, some of the tumor cells, they may invade the scrotal sac, and when they invade the scrotal sac, they may lead to seeding of the tumor cells within the scrotum and can lead to the spread of the tumor through that. And so you'll have to perform an orchiectomy right after the biopsy, and that is a very painful procedure, and you would want to avoid that. Now, these are the additional points. As I said, that these seminomas, they arise from germ cell tumors, and these germ cell tumors can either be pure tumors, which means that they can either be pure seminomas, or 15% of all the seminomas, they may have syncytial trophoblasts. These are the cells that are also derived from germ cells, and these cells are embryonic in origin and produce human chorionic gonadotrophin, HCG, and this can be used as a very important tumor marker for the diagnosis of a mixed tumor, seminoma with a syncytial trophoblast. Now, the seminoma may it also be present with other germ cell tumors, like the ones that you'll find in other lectures. Thank you very much.